5.
It is a common practice when you make a medical appointment that you either wait a while to see the doctor, or maybe you can get in sooner with a physician's assistant or a nurse practitioner.
So do these professionals carry the same qualifications as an MD? 8 News Now reporter Sasha Loftus has a look.
Physician assistant or MD? What's the difference? Medical professionals say when it comes to general care, they're both extremely knowledgeable. In fact, PA and nurse practitioner work serves an important purpose and could close a serious doctor care gap here in Southern Nevada. With every exam,
she just makes you feel very at ease.
This Valley couple stays happy and healthy.
Checked our heart, our lungs, our ears, our mouth, our eyes.
Larry and Beverly Mosser keep their medical needs in check.
Your heart is amazing.
Good.
I wish my heart would be as strong as yours.
With the help of their favorite physician assistant, Liza Bryant.
We fill that void with the shortage of doctors, and I think more people are realizing that.
The Mossers are just a few of millions who see PAs and nurse practitioners for routine exams instead of a medical doctor.
I think that more exposure to the a PA or nurse practitioner, then they understand that we do just as much as a doctor does, maybe even more.
Bryant has dedicated decades to the field and truly enjoys her time with every single patient.
We've got a lot of patients that just say, hey, thank you, I'll come back and see you.
When most people make appointments at a family practice, they can see a physician assistant like Liza right away.
Well, I put shame to some of my 30-year-olds who don't exercise.
Or wait weeks, maybe months to see an MD.
They can do a lot of just about all of what the doctors do.
Dr. Troy Bertoli tells me this option closes a crucial gap in care.
The nurse practitioners and physician assistants can write prescriptions, they can initiate referrals, and they can order tests.
A University of Nevada Reno study shows our state has the 48th lowest number of acting primary physicians across the U.S. That translates to about 62 doctors for every 100,000 people, compared to a countrywide average of 82. Not nearly enough for everyone.
Patients will be waiting months and months and months to see a physician.
So Bryant and Bertoli agree, when someone scores a speedy appointment with a PA, it can solve a small problem right away.
Well, I think they should feel comfortable with it because usually those folks have other people to question and ask about.
Because in quite a few cases, the longer you wait, the worse a condition can become.
But you know you're going to be taken care of if there's something that needs to be taken care of, because the PA will find it.
So the Mossers say everyone should take advantage of this option.
If it's just something simple, then this is going to take away from the long waits of seeing a medical doctor.
And take the first step.
Start with the PA, then do the general doctor, then do your specialist.
To solve any kind of concern.
Then you feel very comfortable.
Now, it is important to note physician assistants and nurse practitioners are required to work with and consult an MD within the same practice. A physician assistant usually has a bachelor's degree with 2 extra years of medical training, while most nurse practitioners start as general nurses, then continue their schooling afterward. Sasha Loftus, 8 News Now.
It is also important to note that medical doctors do, of course, have a higher level of education. After earning an undergraduate degree, they must pass the MCAT, attend 4 years of medical school, and complete a 3 to 7 year residency program before even being licensed. Medical doctors can also perform complex surgical procedures, which NPs do not.